So we can dive into this topic. Today's webinar is Learn About Naloxone Vending Machines, and we have two speakers that I'm very, very excited about, Thea Oliphant-Wells and Joseph Hunter, who are going to talk to us about their experiences setting up naloxone vending machines. I'm Allison Newman at the University of Washington Addictions, Drug and Alcohol Institute. I'm going to say this once, so I'm sure I'll say it again. This webinar is going to be recorded and posted within a few days, and we'll be able to share that as soon as we have it. So I bet that question will come up again, so we'll put it in the chat, but this will be recorded so you can share it out. So just some reminders, this is a Zoom webinar, not a meeting. What that means is only our hosts can share video and audio. Panelists can't see or hear participants. So if you have questions, just enter them into the Q&A. You don't need to enter your name and title into the Q&A. Just letting you know this webinar will be recorded and shared in the next few days. So I'd like to begin by acknowledging that as we gather today, we are on the ancestral homelands of the indigenous peoples who have lived on these lands since time immemorial. Please join me in expressing our deepest respect and gratitude for our indigenous neighbors. So I'm just gonna dive right in and then hand it over to our panelists. So naloxone vending machines, what are they? Why are we talking about this? They are part of a larger strategy to reduce overdose deaths. They increase access to naloxone, the opioid overdose antidote, and often include other harm reduction resources. A little background on naloxone vending machines. There was a recent paper that came out that evaluated the impact of naloxone dispensation at public health vending machines in Clark County, Nevada. With the likely result that they contributed to a reduction in overdose deaths. That they calculated how many overdose deaths you should have expected in that county during that time frame, and that in places where there were in the place where there's the vending machine, there were fewer than expected. So they really recommend that communities consider implementing public health vending machines. And also an acknowledgement that the COVID pandemic worsened the overdose crisis, which I think is a really important context to consider as we talk about this issue. So I'm going to hand it over to Thea and Joseph to introduce each of themselves. I have the slides, so Thea and Joseph, as you want me to advance after you introduce yourself, just let me know. So Thea, do you want to introduce yourself first?
Sure. I'm Thea Oliphant-Wells. I am a social worker by education. I am a harm reductionist by religion, probably. Harm reduction really is my passion, both from my own experience accessing harm reduction services in my time of need, and also being able to pass that on to other folks. I work for Public Health Seattle King County, where I get to work on vending machines and various other harm reduction initiatives in King County.
My name is Joseph Hunter. I work for the North Central Accountable Community of Health. I'm a person with lived experience. I struggled for many years with addiction and am completely transparent about my story and my passion, because I want to be able to lead harm reduction projects like this. I work in Wenatchee, Washington, which is a real rural conservative community, and some of this work is an uphill battle, but our efforts will not cease.
Mm-hmm. Thank you, Joseph. So I think we'll dive into the slides. First, Thea is going to talk about her project a little, and then Joseph will talk about his project, and then we'll have plenty of time for questions. So if you have questions, feel free to enter them into the chat, but we are going to hold them until each presenter has gone through their slides.
Thanks, Allison, for setting the stage. So for the DROP, which is the name of our project here in King County, it's the Direct Resource Outreach Project. And so the DROP started in 2020 by just, hey, what do we think about doing vending machines in the community? And so I started by meeting with the Track B and Southern Nevada Health District folks, to ask them about their vending machine program, which was the first in the country. Vending has been historically more popular in European countries, and so it's very exciting to see this, taking off across the states. We did, based on conversations with the Nevada folks, I reached out to Vendnovation, which is the company that does vending software, and they happened to have a couple of machines that they were looking to get rid of, and we had some end of year funds. So it was sort of magical timing that we got our 2 machines for a deal. And then the hard work started. 2021 was a lot of meeting with potential sites and trying to get community buy-in. And we had a number of places that wanted to partner with us on this that just didn't quite fit our criteria, which I'll go over in a bit. And then designing all the kits that go in the machines. We do nasal Narcan, injectable naloxone kits, fentanyl test strips, condoms, and lube. And so all those little kits take time and all needed labels and packaging and etc. We created our access form. And finally, this year, we managed to launch our project. In April is when they officially were online and functioning well. And so we've had about 6 months of data to gather, which is great timing for me to be able to share with y'all. Next slide. These are our two vending machines. The one on the left is the vending machine from the Pierre Kent location. And the one on the right was our Seattle machine moving into the Capitol Hill location of Pierre. The artwork is really beautiful and was done by someone through Pierre. And so I don't even know the name of the person who designed the machines. But they did some great doodles and then just changed the color based on the color scheme of their different locations. So when we were looking at why would we do vending machines, really it was about creating a new access point, serving a different crowd than maybe our traditional naloxone distribution sites. A lot of times we've just focused on people who inject drugs, and especially in the time of fentanyl, folks are smoking more drugs and may not be accessing SSPs. And so we wanted to create access for both people who don't inject drugs but do use drugs, and also their family members or other people in their lives. And so finding spaces that felt warm and welcoming to a variety of people was important. For that purpose. And we really wanted to target younger folks who use drugs, especially in the time of fentanyl. We've seen younger folks dying of overdose. And so we definitely wanted to try something new and reach some of those young people that we were looking for ways to serve. And there is me and Dan from Pierre, Seattle with the machine all stocked and lovely, which it's moved from that spot since then. But definitely it feels like it's an appropriate part of their space. It's a beautiful machine. Their space is quite beautiful. So I think it's a nice fit. Location. So that was really hard for us to site these machines. Finding a place that was open to the public, and not just, any public person, but like would be welcoming for somebody's grandma that wants to make sure that they have Narcan to keep them safe, and also someone who's living outdoors. So like finding those spaces that welcome all sort of types of people who need Narcan access was really important. Accessible by public transportation, or for our South King County location, we wanted to make sure that people had parking as well. A new access point that was not a duplication of services. Of course, our SSPs are like the greatest at dispensing naloxone, and they would be great places for us to have a vending machine, but we didn't want to duplicate the access. And so it was kind of hard because all of our natural partners were like, us, we want the machine, but they were already serving the community. And so anyhow, we just wanted to make sure we were creating some new access in a new neighborhood. They needed to be welcoming and not judgmental. And of course, that is for the grandma and, the other, folks in the neighborhood. So I do love that. And the staff needed the ability to support it. We recognize that with an online registration, which we'll hear more about, a lot of our folks need assistance with that. They don't travel with a smartphone. They don't know how to scan a QR code. And so there's always staff on site able to assist people and also provide training as needed, which is a really nice feature. We wanted to make sure that our vending machines were in areas where there were a lot of overdoses so that we were sure that we were going to be in communities that most need. Also, these machines are indoor machines. We didn't purchase or accommodate them with refrigeration. And so we needed to find indoor sites. A lot of places were like, we have the perfect outdoor location. And unfortunately, that just wasn't going to work for these two machines. And then internet and power. I'll tell you more about the internet situation, but yeah, there were a lot of things to consider with the location, and a lot of conversations that kind of didn't go anywhere, honestly. A lot of meetings that were like great for getting to know each other, but not for placing vending machines. Next. And stocking the machine, all those beautiful products that we got to keep in there. And next slide. So for our program, we do have a web-based registration form. It's like a little survey that you can access with a link. And we have the QR code on the machine. So for folks who do have a smartphone, they could walk up to the machine, scan the QR code and open the form. They could also get help with the staff. Sometimes staff will just do it for the person on their phone. Sometimes staff will take the person to a computer and they can fill it out there. There's a number of different ways that peer manages that piece of access. And another reason that having folks on site that can help is really helpful for our project. Most questions are optional, absolutely confidential. We don't ask any identifying information. There's 2 required questions only of everything we ask. And the first is if they've carried naloxone before. And then if they say yes, then we do ask if they've gotten it from the machine before, which helps us to count unduplicated folks. We know sometimes people lose their code and need to get a new code, and we wanted to make that totally doable and not a data nightmare. And then if the other, question that is required is if they're willing to answer more questions. And so they can say no and just skip right to the end. I wanted to make sure that it was super optional for people to give us more detailed information. And so they can skip that, or they can decide to say yes. And in that case, it asks like the neighborhood they live in, maybe their age, but certainly nothing that's too personal or identifying. Next. We always have, a fentanyl warning. We also have a video. If folks are accessing fentanyl test strips, they have a little video they can watch, making sure that folks sort of review the best, overdose prevention information that we have for safer drug use. And once they submit their information, then the next page will give them their code. It also will give them, you can click to next. It'll also give them a list of resources so they can click on any of those that will open in a new window so they don't lose their code. And then once they have their code, we give them little cards, which you'll see on the next slide, that they can write their code down on and keep it in their wallet. Or if they lose that, they are more than welcome to come in and just request a new code saying they've already used the machine, just so we have an idea. People can choose 2 items each week, which we are going to change our recipe a little bit. So far, it's been 1 naloxone product and 1 fentanyl test strip. It sounds like our Seattle location, folks might like 2 test strips instead of a Narcan and a test strip, and the Kent location maybe wants more Narcan. So we're going to mess with our recipe a little bit based on the feedback that we're getting from our customers. They can use their code every week and get what they need. And yeah, we definitely are changing how we do things based on feedback, which is really nice. You know, this is our pilot, so we fully intended to tweak and change things as we go. Next slide. So first 6 months of data, you can see some of our stats here. I will give one caveat: the condoms and lube have not always been fully stocked. I admit I've had to focus on our overdose prevention supplies more, but I think that's resolved. So those numbers may be going up. But yeah, we do 5 packs of test strips. We do injectable naloxone kits that have 2 doses, a syringe, an alcohol pad, directions. Also with the nasal Narcan, you're going to get the wonderful ADAI opioid overdose brochure to help you learn how to identify opioid overdose and respond. Next slide. And this was our monthly average before the 2 news stories just broke last week. So I imagine this average has now changed because we had a really busy week last week. But before any media, this was our average between the 2 sites. But like I said, it's gone up a lot just since last week. We had a story in Como. The next day we had a story in Cairo, and things really shot up from there. In the questions that we do ask people on the form, one is, you know, whether they've carried naloxone before, and 39% said that they had never carried Narcan before using the vending machine. So we know we're giving access to new folks quite a bit. Next slide. Challenges and considerations. I think this is important because there are a lot of challenges and things to think about if you're planning to do public health vending machines. Assembling kits takes time. I want to give a special shout out to Caledonia, who's a UW student who works part-time with us assembling kits for the vending machines. I honestly was really swamped before being able to hire her part-time to help out. And so anyway, thank you, Caledonia. Machines break. I just had to drill a lock out of a machine for $305 last week. So if you are planning to do vending machines, be sure that you budget for repairs because they will be needed. Also, like I said before, I'm a social worker by education. And so, you know, School of Social Work didn't teach me how to be a vending machine repair person or any of the number of things that I have had to become to be part of this project. And so just identifying that, like, it's a very unique knowledge set. You're probably not finding someone that's a public health vending expert out there. And so there may be a lot to learn. The sites were very difficult to identify. We had some partners who were so wonderful and excited, but didn't have like the right space indoors, or there was always like something sort of missing. We also talked to a number of places where there was a lot of stigmatized thinking around people who use drugs. In some of those meetings, it was like, but what about the children? And we aren't talking about anything dangerous in our project so far. We've got Narcan and test strips, none of which can harm a child. And so unless they were opioid dependent, anyway, kids are not harmed by Narcan. And so, you know, just some of that stigma-based thinking, like, oh, well, what if people are offended when they see fentanyl test strip in the machine? And I don't know how to manage people who are offended by words, but those are real considerations when the sites are bringing those things up. And so, you know, there is a lot of stigma. A lot of places were not excited to welcome people who use drugs into their spaces. Another challenge that I didn't put on here, but certainly was a big deal, COVID. I mean, 2021 was the year I was trying to cite these two machines, and COVID was still very much alive and well, and a lot of places were not welcoming folks indoors. They were providing services outdoors, or had limited capacity inside. And so COVID definitely impacted where we could locate them. The registration can be a barrier. You know, we toyed with, let's just have them push a button and get what they need. Of course, we had, how do we like meter supplies going out the door? What if somebody just empties the whole machine and then we've lost all the supplies? And so registration form became a thing. Of course, it is our pilot and we're going to evaluate it and potentially can change it up if we need to. But I do recognize that like any registration can be a barrier. We don't have our SSPs in King County. Folks don't register as a needle exchange customer. And so in some locations, it's really easy because everyone has a number associated with their SSP account. We have anonymous exchange services, so we don't have folks with account or numbers associated with their SSP services. So that was a little bit unique to our setting. And, you know, ask yourself, would a cupboard do? Would a mailbox do? There are some places and jurisdictions where like a mailbox outside their door with free Narcan in it 24 hours a day is meeting the need of the community. Sometimes you could just have a cupboard that says free Narcan in your space so people know they can go and help themselves to it. There's a lot of different ways to create access. And so deciding if and when a giant expensive machine is really warranted, needed, the best fit for your population that you're serving. I think that a lot of times a basket can accommodate the need in some settings. And so sometimes it was a lot of, hey, I don't think a vending machine is right for you, but let's talk about ways to get access. Let's talk about ways that we can meet that need. So I did a lot of that with folks who may not be great for a vending machine, but certainly had a need to be distributing naloxone. Next. Oh, here's some wonderful quotes that our manager of Peer Kent put together. Just feedback from the machines, stories that she's been collecting from folks. It's been really amazing to see they're creating access and working with people and training them. And so please do take in all the quotes. And this is from their manager. They have been such an amazing site to partner with because Peer is all about supporting the community. They already have like the right mission and values. They are part of our Train the Trainer project. And so Public Health Seattle King County works with cultural groups to design training that is focused and appropriate for their population that they serve. So we've partnered with like the Somali Health Board and Seattle Indian Health Board and different cultural focused healthcare groups. And Peer is one of our Train the Trainers specifically for their work with the LGBTQIA community. And so they have a lot of training already and they know how to train others, which is like a very nice complementary relationship. This is my favorite story, so I am going to read it out loud. I spoke with a couple who came in looking for information. While sitting in the lobby, they saw the Narcan vending machine and we got to talking about how their lives had changed since transitioning from using heroin to using fentanyl. We talked about safer use strategies and I discovered neither had ever used naloxone before. I walked both through getting kits and showed them how to use it. A couple weeks later, the woman came in to see me and let me know that she had used the Narcan on her significant other and saved his life from an overdose. Following his hospitalization, they both entered detox and were recently released. They had started IOP and were sober 19 days at that point. It's hard for me to even get through that story without getting choked up because, you know, that's what we're in it for. We're in it for the outcome. And it's wonderful to see those outcomes, that people are able to, survive and hopefully thrive. We want to give people, not just keep them alive. We want to help them to find whatever their joy is in life. And so I just feel like really proud that we got to help those folks on their journey. And yeah, people who don't even realize they need Narcan sometimes realize, like, oh, I live in a building where there's a bunch of people who are clearly using opioids. This might be good for me to carry. And so I think sometimes we get to have those conversations with people, and with peers specifically, it's a lot of folks who are new in recovery. So they know people who need Narcan. They also know about what overdose looks like, and can be in a really great position to save others. And also they're at higher risk for overdose. Folks who are new in recovery have, especially if they're in abstinence-based recovery, they have a much lower tolerance and are more likely to overdose if they do go back to use. And so it is really important that folks who are newer in recovery have the tools that they need, and that people know that they're at a higher risk for overdose. Next. All right, Joey.
Thank you, Thea. That was an awesome presentation, and I really like how our vending machine projects are similar in some areas and different in other areas. All right, well, good afternoon, everybody. I work for the North Central ACH, and I just wanted to share this slide to talk about a little bit of what we do other than the vending machine work, and how I got into this role. The ACH hired me in 2020 in the middle of a pandemic. They wanted to use my lived experience to help promote harm reduction and peer work in our region. Our focus is Grant, Chelan, Okanagan, and Douglas County, which are very rural communities and have a lot of barriers around transportation and housing when it comes to this population. And so we really focused on training peers on how to use their lived experience to leverage people into recovery and to connect and feel like an equal when it comes to supporting them into their first few steps of recovery. We have 130 recovery coaches trained up, and they're just out in the community in different stakeholders in our treatment centers, some behavioral health inpatient and outpatient services. And it's just an awesome project. Next slide. So these amazing people right here are all close friends of mine. We started a grassroots coalition with the help of the Washington Recovery Alliance, and it's called the Central Washington Recovery Coalition, and that's really where this project was birth. I say birth. I got asked by Beacon Health Options, which is one of our amazing organizations that support our region, to help them spend some unspent substance abuse block grant dollars. And I really like spending money, and especially when it comes to this type of work. And so I brought that information to our coalition, and we were all distributing Narcan by hand, and it's really a time consumer to drive around in the community and distribute that. And so we really wanted a way to be able to give people low barrier access without having to deliver it by hand. Next slide. Our goal of the project is to increase low barrier access and to effectively reverse overdoses. The project was really, at first it was, okay, how do we purchase these machines? Where do we go? I didn't really have any support in the beginning because there wasn't a whole lot of Narcan vending machines. I found an organization in Las Vegas and called them every day till they answered. It took a long time before they answered, and I really just kind of picked their brain on, what would you have done differently? Being that they're not a rural community, we had to strategically kind of do things a little bit different. Next slide. So we have 3 machines currently, one in each county. Chelan and Douglas are separated by the Columbia River, and so we don't have one in Douglas County at the moment. And when we were like considering where do we put these and how do we go about doing this, we found that placing them in organizations, community-based orgs who already serve this population, that are already a trusted resource by a lot of folks who struggle with opioid use disorder. And the first location was our local Alano Club. I also am the president of that nonprofit. And we get a lot of people who come in that just want to charge their phone, somebody to talk to, a hot cup of coffee, a place to wash their hands, maybe wash their face. And we just realized like that's a perfect location, not only because we get a lot of high foot traffic from people in active addiction, but also because we have certified recovery coaches working that front desk who are there in case they want to engage in support. We also wanted it open to the public. Our Alano Club is open from 10 a.m. to 10 p.m., sometimes even a little later than that. And so having this resource during non-business hours, I think is an awesome thing to have. Easy access by public transportation, that's always a struggling barrier. And so we still do hand distributing, but these machines are placed in real easy to get locations with the bus system. A lot of people just show up on foot. There's no sign in, no check-in required. We really wanted a low barrier. One of the things Las Vegas told me is they had, you had to sign up to use the program, and then they issued them some sort of scan card, and that scan card kept getting lost. And so they spent a lot of time reissuing scan cards for people that just continually kept losing them. And so we wanted to kind of avoid that problem. We wanted family members who have people who struggle with SUD to be able to access it in non-judgmental locations. Next slide. So this is our pre-distributing survey. This is a survey that is not mandatory. It's on just a scan code on the side of the machine that people can, if they're willing. And some of the questions are like, where did you get this? That shows our 3 locations. Is this your first time accessing Narcan? Why are you getting it? Has the Narcan you received from this machine helped reverse an overdose in the past? And if you were unable to get Narcan from this machine, would you get it somewhere else? And from my own lived experience with my struggles with opioid addiction, I kind of knew a lot of these answers and where people would lean, but I wanted to give our funders some of this data to be able to support the importance of the machines. Next slide. This is our post-use survey. So people who, they came and got a box of Narcan and they need another one. This is another survey that we have that's, again, not mandatory for people, just to give us some more quantitative data. Was this Narcan used on an overdose? Was it effective? How many doses were used? Where did you get it? Are you willing to answer some more questions? What city was the overdose? Was 911 called? Did the individual go to the ER? Has the individual experienced an overdose in the past? And I was pretty shocked at some of the data that we collected on this. We realized 911 wasn't being called in almost 70% of our overdoses, and the folks weren't going to the ER. which was concerning, and it just shows like how many overdoses go unreported because they don't go to emergency services. Next slide. This is our pre-distribution, some of our survey results, how many boxes were distributed. As you can see, for the first 5 months, we only had a Wenatchee and Moses Lake location, and then in April we got another machine in Okanagan County. And kind of what we seen was we flooded our communities with naloxone, and then they kind of plateaued out. And right now we're averaging about in between 30 and 50 boxes a month per machine. Next slide. Why are you getting this Narcan? I'm around people who I worry will overdose, and I want to have it just in case for some of the more, some of the higher results. Next slide. This was one of the more interesting survey results. 36% reported this was their first time accessing Narcan. 22% reported that the Narcan they received in the past helped reverse an overdose from this machine. And 59% said that they would not be able to get it from another location. I know from my own experience that I was always too ashamed to go in to a doctor and ask for it. I didn't want to stigmatize myself as a heroin addict. And so I know that a lot of people feel that same way now. There's such a stigma with this in Eastern Washington, and I'm sure it's everywhere, but that people are afraid to label themselves. And so low barrier access points like this are vital to be able to get this resource to the people that need it. Next slide. So 26% reported that more than 2 doses were used, and recently we've kind of allowed people to grab 2 boxes because of this data. Originally, we thought, that the 1 box was sufficient, but with some of the potency of this fentanyl, even our 911 responders, EMS, and fire department are letting us know they're having to use multiple boxes to reverse some of these overdoses. 65% reported they did not go to the ER or contact emergency services, and 45% had experienced an overdose previously. We just got 2 months worth of data back, and so that 39 number for lives reported saved is up to 55 now, which is amazing. That is just that fact right there shows like that these need to be in place, whether it's in a vending machine or, like Thea said, in a locker or in a basket in an office. That having this resource that gives them access and doesn't stigmatize and doesn't judge is very important. Next slide. Some of the lessons learned was due to the pandemic, we had a lot of supply chain issues. Our machines are $5,000, a little under $5,000 per machine. They're not refrigerated. They hold 90 something boxes in our can total. And they even offer one that holds 20 something boxes, which is we're planning on ordering 5 more machines for 2023, because we have a lot of little rural communities, like Leavenworth and Chelan and Soap Lake and Quincy, who have a fentanyl problem, and they don't have this type of access. And so being that the smallest part of this funded project was the machine cost, being that Narcan originally was $75 a box, it now has lowered to $47.50, which makes it so a lot more organizations are being able to afford to do a project like this. has been helpful. I think location of the machines is important. You know, some of those non-clinical settings, I think, are very beneficial for people to show up and not feel stigmatized, that stigma associated with it. Braided funding is been an ongoing thing for our projects because of the naloxone cost. The target audience was broader than we expected. I'll share a personal story if I have time. We had some emergency services come in one night and utilize the machine because they didn't want to drive 15 miles. They had ran out. It was one of those nights where they just had ran out of Narcan, and so they came in and accessed our machine. And then we had a lady come in one night. I was working the front desk at the Olano Club, and she had shared with me that her husband had been on opiates prescribed by his doctor most of his life and had recently been cut off and had turned to fentanyl. And she wasn't comfortable letting her family doctor of 20 years know that part of their family. And she was just so excited that she could come in and access this and not have to stigmatize and label her family as a family that has somebody struggling. And I just feel like stories like that are important. We also recently did a qualitative data study, which is called ripple effects mapping. And it was a pretty powerful experience. We invited some pretty prominent members of the community who are stakeholders with this type of work and serve this population. And then we also invited people who are willing to share their story of how naloxone saved their life. And then a lot of recovery coaches who work in the locations of the machines. And we each just got opportunities to share, you know, some of the impacts of the machine in the, you know, in the almost 1 year that they've been going. And we haven't got the results of that, but what I can tell you, it was pretty awesome and unifying to have everybody in one place sharing the impacts of these stories of the vending machines. I think that was my last slide. I just love how these vending machine projects have been popping up all over. I've done a couple news articles with some, you know, different news agencies, and I've gotten phone calls from other organizations across the US. And I know that the ripple effects of the projects like this that have happened in Washington State have been pretty huge.
I just want to say thank you both for sharing the photos and stories and your whole process. What made me want to do this as a webinar was you both had gone through similar but different processes in getting this going, and we're in just such different locations. So we do have we have 10 questions now. One is hopefully easy, which is, how do you pay for Narcan? Is it the responsibility of the site?
For us, nothing is the responsibility of the site as far as cost. Public health pays for all the things or gets someone else to pay for them. You know how that goes. The Department of Health, the Washington State Department of Health, has supported our nasal Narcan in a very generous quantity. I have to say thank you to DOH for that. But we do utilize some federal funding, some county funding, some state funding. We really use all sorts of different funds to keep those machines full.
Yeah, and it's the same for us too. The whole project is funded by outside organization. The Healthcare Authority helps fund this, and also Beacon Health Options is who really kicked off this project with us and supported all the funding. Our host sites they don't have to pay for anything.
So this is a question I think both of you can speak to, which is around stigma. Question is, something we encounter a lot as a rural health jurisdiction is negative public perception of harm reduction strategies. People come to us frustrated with found syringes, naloxone packaging, and other harm reduction supplies we distribute. Have you found any strategies to combat community stigma? Likewise, how do you handle those conversations?
Yeah, well, I am in a very rural part of Washington State, and it's been an uphill battle with this project, and how there's been a shift recently. And I think the main reason is there's been a lot of community education on harm reduction. And one of the most important things I think that has helped shift people's opinions on harm reduction is we share a lot of real life stories where we bring people on and let them, tell their story of how Narcan saved their life and they wouldn't be here today without it. And we do a lot of community events, our coalition does, with educating people on this stuff.
Is there any way that you all deal with stigma and perceptions? You spoke to it a little bit, but.
I mean, around the vending machines in particular, maybe no, but we do have like a new anti-stigma campaign called Don't Count Us Out, I think. Is that the name of it?
I think so. I saw one of the billboards.
We have been doing some combating stigma type of work in the county for a number of reasons, not just around harm reduction, but it's a thing. I mean, it really is, especially, South King County is sort of like our more rural area, even though compared to a real rural area, it's pretty suburban. But that's where we have a lot of challenges. And oftentimes any space where people who are living homeless or people who are using drugs feel comfortable coming to becomes like a target, like you're bringing these people to our neighborhood rather than like serving the people in the neighborhood with services that they need. So, it's always a thing. Stigma's always a thing. And the best that we can do is just, present data. If someone is not a data person, cost savings are always a good thing to focus on because we know harm reduction services save a lot of money.
I have two questions about the prescription status of naloxone. One says, can you go over again if there's a provider associated with each dispensing of Narcan since it is a prescription medication? What other prescribing rules were followed to make this work?
We have a standing order in Washington State, and so we don't have to do anything patient specific. We did look into could we bill insurance through the machine, and that would have additional requirements of having that person's personal information printed on the Narcan. Distributing Narcan is no biggie for us, thankfully.
Yeah, just to clarify, we have a statewide standing order for naloxone. So even though it's a prescription medication, it doesn't have to be prescribed by one provider. So the health officer for the state basically is a blanket prescription. I like this question. If we have a site that would be better served by a basket than a vending machine, how do we go about getting the kits and what kind of tracking is required? Could maybe speak to your own jurisdictions, but.
Yeah, so Seattle King County, we have a number of different options depending on what kind of organization you are, who your population served is. So I can't really give a blanket answer. If programs are in Washington State and looking to do naloxone distribution, I usually connect them with Sean Hemmerly at the Department of Health as like the state Narcan folks. Oftentimes they're able to accommodate organizations that are looking to do Narcan distribution to folks who are most at risk. So if you wanted a basket, they might be able to help you fill it.
Yeah, I would just echo what Thea said.
Let's see. I see this is related. Could you speak more on the pros and cons of vending machines versus bins, baskets, mailboxes, etc.? There are obvious cost considerations with vending machines that may be difficult for some folks to access, but are easier to track supplies and obtain user data. Joseph, do you want to speak to that one first?
Yeah, I would say both methods are great because it, like Thea was sharing earlier, some smaller orgs maybe don't have the resources to go directly to a vending machine, or maybe they don't have the space for it. But I think if you're getting Narcan out to people, whether it's in a basket or in a vending machine, or you're hand delivering it, then you're doing your community a very awesome service.
And I have one that I think is more specifically for Thea, which is why was Evergreen Treatment Services not a host site? I have one way that I think is relevant to that, which is under a substitute Senate Bill 5195, opioid treatment programs and other programs that work with people with opioid use disorder are required to try and use people's insurance to provide them naloxone. So it would not be a good fit given our current laws.
That was a factor in that they were already required to be distributing Narcan. Whether or not that was working out might have been a different story, but because of that, and some other behavioral health locations also are moving in that direction.
And I have another one for Thea and then a bunch for Joseph. This one is for drop. What other supplies have you considered to include in the machines or would want to include in the machines? Is it actually a three-parter? Also, is there better data around whether people are taking injectable versus nasal, and how many condoms or lubes are people able to take out of the machine?
The condoms and lube are a separate number, so they can have unlimited condoms and lube by just putting 5 5s into the machine. So we don't limit access for that. We have considered injection supplies, pipes, I mean, all the things we would think about. Of course, we're at Peer, so there's a lot of folks who are newer in recovery accessing support services there. And so part of our thinking about what products is we didn't want to trigger people who are newer in recovery by seeing, a bubble pipe and in their space where they're accessing support for their very new recovery. And so if we had a machine that were in a location that would be more friendly to all the things, I would like to have all the things. Kent specifically, I think, would like to add pregnancy tests to their product array. And they are increasing services, STD checks and other sexual health things. So it would be sort of a natural complementary thing as we're bringing more folks into that location. And so we're definitely open. Folks generally are taking nasal a lot more than injectable. We put the injectable in there partially because we didn't know if we were going to have enough funds to support the nasal Narcan forever. And it's actually surprised me that people take it more than I thought they would.
Here's a question for Joseph. Joseph, you might have answered this, and I apologize if I missed it, but if you are not requiring registration or a code to access the Narcan, what exactly are they doing to get it out of the machine? Have you noticed theft or misuse of the vending machines?
No, because we don't require anything, our machines, we keep them right by the front door, so people don't feel like they're forced with engagement from the community-based organization that they're housed at, and all they have to do is push at F7, whatever number and letter correlates with that box, and then the recovery coach at the front desk monitors that in case people want to, if someone's grabbing 4 or 5 boxes, they're going to say, look, you're only supposed to get 2 at a max. They're allowed 2 per day. We had 9 overdoses in one of our homeless camps just in one day. And so originally we were going to be a little bit more stricter on how often they could come back, but because of the increased number of overdoses happening, we just decided to allow them to get it per day if they need.
That's great. I have another sort of related question. I have two that are interrelated. What % of vending users fill out the survey? And then do you have a lockout time on your machines to prevent users from inventory dumping?
No, we don't have any lockout prevention. Our machines are monitored. They're really close to the front desk of each one of the organizations, and so they're closely monitored by a recovery coach that is there. The other question, well, I forget what it was.
Oh, I put it as answered live. Now I have to go back. Oh, what % of vending users fill out the survey
Yes.
since there's no registration?
Yeah, it's right around 10, maybe even a little bit less than that, 10%. We put a scan sticker on the side of each box of Narcan in case people want to do that survey when they get home. And then also it's on the machines. But our recovery coaches, what they've let me know is after a person comes back and they, they're a return, like say they utilize the machine often, they get to know that recovery coach, and then they start opening up to them. And then that recovery coach lets them know that those surveys are really going to help us sustain this work. And so, but we definitely don't want to force people. We'd rather just get them the Narcan and not force that data collection.
So we are very close to the end of our time. So I just want to share a comment that was put in the Q&A. Not a question, but I wanted to thank you for your time. We are starting an Naloxone vending machine program around the community in San Diego County. So it was great to hear about your work and some of the limitations that you've experienced. I'd love to chat at some point if you have the time. And I think you can, I can send you this person's email. Thought that was very nice. I wanted to have there are a lot of questions here we didn't get a chance to answer, but I will send them to Thea and Joseph and we'll get answers to these and then post it along with the recording to make sure everyone got answers to their questions. You can also email me and Thea, who put her email in the chat. You can email Thea and Joseph to ask them questions directly. This recording will be posting probably in the next few days on stopoverdose.org and also sending out along for everyone who is able to attend. So any last questions or comments, Thea and Joseph?
No, actually, I do have one comment. If folks are planning to do Narcan vending machines, there is a roundtable meeting that happens with projects all over the country that are either doing this work or looking to do the work. So you can always let me know and I'll connect you with Jessica at the Southern Nevada Health District for that.
And anybody can email me if they have other questions that they want to ask. I put my email in the chat.
And I just want to say a big thank you to Thea and Joseph for their time and expertise and perseverance and creativity in getting these projects done and showing that it can happen in Washington. So just a big thank you to you both for being here and for everything that you do.
Oh, you're
So-
welcome. Thanks for having us.
Yeah. All right. Well, thank you everyone for attending. I will make sure to get answers to your questions as soon as I can. All right. Bye.